Good morning. Hello, I'm Wendy Doyle, President and CEO of United We. Welcome to the release of our study focusing on childcare licensing in Missouri. Thank you all for taking time out of your day to join us. Please save your questions. We'll have some time at the end. You can drop them in the chat. And if anyone has a note-taking bot joining us today, we're going to disable those. We will be recording today's webinar and we'll be sending it out. Advancing economic leadership for women is our North Star at United We. We know there are many barriers holding women and families back, but childcare is a significant workforce development issue facing Missouri and most states across the country. As many have heard or experienced, childcare is extremely expensive and is difficult to find at times. Additionally, economic barriers for childcare providers are significant. They're struggling to stay open, meet licensing requirements, and pay a living wage to their employees. To gain a better understanding, United We conducted multiple focus groups of childcare providers. We wanted to listen, we wanted to hear, and we wanted to learn. And we learned from providers that the amount of paperwork to do business is burdensome and can take hours of dedicated staff time. Based on our learnings, we knew we wanted to look further into this, and we focused on licensing regulations to better understand the barriers impacting the availability and viability of opening and operating a childcare business. This has led us to Missouri research we are releasing today. A big thank you to our generous funders who helped make this research possible: Missouri Foundation for Health and the Patterson Family Foundation. Now, I'd like to share just briefly about United We and then introduce our guest speakers. At United We work to advance all women's economic and civic leadership to make meaningful change, and we've been doing this work for 33 years. We've focused on nonpartisan policy issues to empower women and their families. It's a team effort, and we've been fortunate to have research and funding partners around the country and really focusing here in the Midwest. As a nonpartisan think and do tank, the way we advance our work for change is through a simple but elegant approach: research, solutions, and then we get to work to get results. Our Policy Lab is an initiative born from a powerful vision for change across 4 states: Missouri, Kansas, Oklahoma, and Arkansas. The lab provides actionable research, innovative solutions, and meaningful results to drive systemic progress for women throughout these states and beyond. We use the word lab because we're setting a template for nationwide change. We're paving the way toward a brighter economic and civic future for all women. As part of the Policy Lab, we've recently released research on childcare licensing in Oklahoma, today in Missouri, and on December 12th, we'll focus on Kansas and then Arkansas in early 2025. We also wanted to briefly touch on a women's entrepreneur childcare project that we've recently completed, which was an effort to generate awareness and ideas to reduce the childcare barriers limiting women's entrepreneurship. As part of the project, we commissioned a high-level overview of state-by-state licensing regulation, really to have a snapshot to understand what's happening within the landscape. It focused on 50 states, the District of Columbia, and Puerto Rico. The study lifted up best practices across 4 aspects, and you can access the research on our website. It focused on content of licensing regulations, fees, availability of information on the licensing process, and frequency of license renewal and inspections. Now, I'd like to highlight our speakers and research participating in today's webinar. First, we have Jamie Birch with the Office of Missouri Governor-elect Mike Kehoe. She is serving on the Governor-elect Kehoe's transition team. We also have Emily Johnson, Associate Director of Operations for the University of Missouri's Institute of Public Policy, Harry S. Truman School of Government and Public Affairs, and also Rachel Dickey, Senior Research Analysis for this study, also from the University of Missouri's Institute of Public Policy. And finally, we have Paula Neth, who serves as President and CEO of the Family Conservancy, a nonprofit organization that supports early education, mental health, and family well-being. Thank you all for being here today. Now, we're going to turn first to our first presenter, Jamie Birch. We're so glad you could join us. We know it's a busy time in Governor-elect Kehoe's office. So Jamie, thanks for being here, and take it away.
Thank you very much, Wendy. Happy to be here, and it's my pleasure to talk to you on behalf of Governor-elect Kehoe to highlight the important work that United We is doing in Missouri. For those of you who don't know, Governor-elect Kehoe was raised by a single mother, and so he witnessed firsthand the challenges that she had to overcome with their family. Childcare is a topic that's very near and dear to his heart, and he knows that when women can succeed economically, their families, their communities, and their state succeeds as well. One of Governor Kehoe's priorities is workforce development, and we know access to childcare is critical to workforce development. Quality early care is very important, not only for children, but also it's good for the workforce, employers, providers, and the economy at large. To grow Missouri's economy to its full potential, we need to come together and make progress in areas of childcare and childcare licensing. Issues of pay, safety, and stress have resulted in a decrease in the number of caregivers, creating a shortage of available childcare slots, which really has a significant impact on workforce challenges. I know I don't need to tell you all that. But it's no secret that the strength of our economy and democracy depend on women's full participation, both in Missouri and across the country, in the workforce. United We has been working to show how childcare is an issue for women and families because of the availability and cost of childcare and the impact it has in women's ability to participate in the workforce. And I know everyone else is impacted by labor market shortages as well, but the more women can thrive, we can create economic opportunities for their families and communities. I want to thank you all for taking time to learn about this important work and for helping United We share this message for everyone in the state. And thank you again, Wendy, for allowing me to join you today. I look forward to hearing the results of the research, and I know Governor-elect looks forward to working with you all over the coming years. Thank you.
Thank you, Jamie. Now it's my pleasure to turn it over to Emily and Rachel, who will be they're longtime friends of United We. We've done multiple research studies together, so we're super excited to release this one today. So Emily Johnson and Rachel Dickey, please take it away.
Thank you. Good morning. Thank you, Wendy, for the opportunity to be here today for the release of research the Institute of Public Policy at the University of Missouri has completed for United We regarding childcare licensing in Missouri. Our research describes the current childcare demand and supply in Missouri, and we examine the childcare licensing process at the state and local level and identify any significant challenges. This research study is an in-depth inquiry into the initial licensing process for childcare facilities in Missouri. It focuses on the challenges encountered by childcare providers during the initial licensing process and what may be done to address those challenges. The study also addresses specific challenges associated with operating a licensed childcare program during the post-COVID-19 period. And finally, we offer policy and practice considerations designed to improve the initial childcare licensing process as a strategy to increase access to childcare in Missouri. And next slide. So thinking about the need in Missouri, 71% of Missouri families have children under 6 and all parents working. This creates an enormous need for quality, affordable childcare. As many of you are aware, the availability of affordable quality childcare has long been a concern for working families, and the COVID-19 pandemic threw an already stressed system into crisis. Next. In 2020, more than 2,000 childcare programs in Missouri closed. Though many reopened, by 2022, there were still almost 400 fewer licensed family homes and centers. Through 2023, Missouri distributed more than $30 million in federal funds to start 308 new child care programs. These changes in the childcare landscape and the ongoing demand for childcare have created the need to investigate the childcare licensing process, specifically the local and municipal regulations beyond state requirements. This research also intends to identify challenges and hopes to find solutions. Next. So, state licensing of childcare facilities ensures that children in licensed care are safe, healthy, and cared for by providers who receive ongoing training to keep children safe, healthy, and engaged. Childcare licensing is intended to prevent harm from coming to children while they are in the care of a childcare program. In Missouri, the Department of Elementary and Secondary Education's Office of Childhood oversees licensing through the work of compliance inspection supervisors who oversee compliance inspectors who provide help through the licensing process to providers and directors. On average, inspectors in the state each oversee approximately 77 programs with a range from 68 to 101 programs per inspector. Childcare in Missouri is comprised of licensed, license-exempt, and unlicensed programs. The state licenses and monitors family childcare homes, which can care for 7 to 10 children, group childcare homes, which is 11 to 20 children, and childcare centers who can care for 21 or more children, and license-exempt childcare centers. As of June 2023, there were 2,970 licensed and license-exempt childcare facilities in Missouri. For our research, we focus exclusively on licensed family childcare homes, group childcare homes, and childcare centers. License-exempt programs are not included. The focus of this research, these programs comprise 81.3% of licensed childcare facilities and provide over 137,000 slots for children birth through age 12. Next. So, though the licensing rules may vary between family homes and centers, all providers are required to complete an orientation, submit proper documentation and forms in a timely manner, clear state fire, sanitation, and licensing inspections, and provide proof of compliance with any hourly or local or municipal rules and regulations. Next slide. For our study, the data was collected from interviews with state childcare licensing staff and childcare providers and in-depth case studies of childcare programs. We interviewed 2 groups of state licensing officials as well as childcare providers. Our participants were all 10 compliance inspection supervisors. 17 of the 33 active licensing compliance inspectors were interviewed. And we also interviewed 7 childcare program directors representing 4 urban and 3 rural counties, 4 desert and 3 non-desert Missouri counties. And a childcare desert refers to counties where at least 3 times as many children as licensed care slots are available. We conducted independent research into the local childcare licensing rules and regulations. Next. And this is a map that kind of indicates the geographical distribution of who was interviewed. The map on the left indicates the counties where at least one interview was conducted with compliance inspectors, and inspectors can serve multiple counties. And the map on the right indicates the counties where we interviewed program directors. Next, we will dive more into the findings of the research, and I'd like to turn it over to my colleague and the lead researcher for this project, Dr. Rachel Dickey.
Thank you, Emily. So there are 115 counties and 1,044 municipalities in Missouri. So as you might imagine, there could be a great number of local regulations for providers to navigate. The next few slides will describe our interview findings, which look at local level challenges versus state level challenges, and then barriers and challenges to the initial licensing process versus the process of maintaining a child care license. Now, not all of these rules and regulations are available in one place, and they are not uniformly available via the individual city or county websites or phone calls to local officials. Examples of some of these additional regulations include city zoning requirements, fire and sanitation regulations, and the like. So on to the interview findings. Next slide, please. Thank you. So city zoning requirements. This is more frequently a city issue than it is a county issue. Inspectors noted that they tell providers generally to check with their local authorities for any city zoning requirements. As for business licenses, these are not required by the state, but some municipalities do require them. A child care facility must then register with the Secretary of State's office to obtain a business license. 5 of our directors mentioned that they were required to have some sort of business or occupancy license, but they did not consider it particularly challenging to obtain. Fire and sanitation regulations. Some counties and cities require that providers meet fire or sanitation requirements over and above those set by the state. For example, one supervisor mentioned that in one of the counties they cover, their health department requires a food service permit that they have to pay for and then renew every year. Finally, we did hear from several respondents that local challenges were either unknown or uncommon in their area, or that local regulations were present, but not particularly challenging. Next slide, please. Thank you. Statewide fire and sanitation rules can also be expensive for providers to meet. For example, a costly fire-resistant door. Next, our staff-related challenges. So hiring and retaining staff, obviously this is not a new issue, but it has been particularly challenging since the onset of the COVID-19 pandemic. Interviewees consistently discussed the difficulties in finding staff and the higher rates of staff turnover, which can be difficult for providers and their communities because even if providers have the physical space to care for more children, they don't have the teachers that they need to stay in ratio. Comprehensive background screenings. These are required before staff can start working at a childcare program, which some providers find difficult. Centers primarily because it reduces staff, and family homes because they find it invasive. Next is Nathan's Law, which states that providers should include their own children in staff child counts. This was a big barrier for family homes in particular when it passed in 2019, because many people opened family home programs so that they could care for their own children as well. Finally, navigating state and local agencies involved in licensing can prove difficult for providers. This can be particularly true for providers who experience transitions between inspectors or family homes for managing the different necessary inspections. Next slide, please. So this one is barriers and challenges to the initial licensing process only. First of all, startup costs often include making necessary changes to the building or the equipment to meet code requirements, and this can be particularly costly. In terms of location, rural areas might have fewer regulations compared to cities, but they also might not have good internet access, which can make it harder to submit documents online and to access and track online trainings. State licensing officials noted that there are quite a lot of rules and regulations and that these can be hard for providers to understand. And if providers don't complete and document them correctly, it can make the licensing process take longer. And directors found the forms and the paperwork involved in getting a license hard to navigate. Next, childcare providers may enter the field because they want to care for children, but they may not be particularly business savvy, which can be a barrier because of the bureaucracy involved in becoming licensed. Next, inspectors observed that providers who were prepared and motivated and organized during the licensing process were able to complete that process more easily. This involves reading all of the preliminary materials and the rule book and knowing what needs to be sent to the inspector. Finally, inspectors responded that providers who communicate well and communicate frequently with them generally have a smoother and a faster licensing experience than those who do not. And directors who reported communication issues with their inspectors noted that it made the process more difficult. Turnover in inspectors can cause additional delays, inefficiencies, and frustrations. Next slide, please. So the barriers and challenges to maintaining a childcare license largely echo the challenges encountered during the initial licensing process. First of all, staying in compliance. Supervisors opined that maintaining a license is not particularly challenging. Providers need only stay in compliance with the rules and regulations that they had to meet to obtain the license initially. Directors also overwhelmingly agreed that the process of maintaining a license was much easier and clearer than the process of obtaining a license. Changing rules and regulation and turnover was identified by state licensing officials as an issue, and they noted that it can be frustrating for providers when rules change and things that were acceptable are no longer acceptable, or when different inspectors interpret the same rules differently. Supervisors noted that the costs required to keep up with the building and equipment can be challenging, and that if regulations change, providers may need to alter the buildings to maintain compliance. Finally, inspectors mentioned that maintaining the paperwork necessary for the annual reviews can be challenging. Further, they noted that maintaining it in an orderly fashion can be helpful because if the providers have the required files but can't find them, this also slows down a licensing review. Next slide, please. Thank you. Finally, we provide considerations in 3 domains: community, administrative, and legislative, and these are based on who really can take action on this. So community actors include the public and nonprofit, private and advocacy organizations. Administrative actors include state officials outside of the legislature, and the legislative actors, the Missouri General Assembly. So for community considerations, providing mentoring to entrepreneurs, facilitating regional and local communication channels for providers, and developing online resources so that providers can more easily access local requirements. And then for administrative considerations, first is developing a specialized team of inspectors that focus only on the initial licensing process. Next is establishing a task force to examine the administrative burden for both providers and state licensing officials. And then to adopt a centralized childcare program management system to simplify and streamline business operations and paperwork. And then finally, legislative considerations, explore legislative actions to replace discontinued ARPA funding, and create a pre-licensing administrative training requirement. So thank you so much, Wendy, for allowing us to present our research.
Thank you, Emily and Rachel. Excellent research. Lot to dive into and digest, but some great points highlighted here. Now that we have the research, we really hope that this creates conversation that will inform some innovative solutions, and then we can actually get results for our children in the state of Missouri. Of course, there is no magic wand and no one solution to solve the childcare challenge. And so that's the focus of this research, is to bring a unique perspective to it. Again, keeping the health and safety at the forefront of all of our decision making, but looking at what we can do to potentially ease the burden for childcare providers to operate their business. I would ask that you take time to review the research report. You can access it on United We's website at united-we.org. Now, I'd like to turn it over to Paula Neth to bring a different perspective and to hear from a provider's point of view. So Paula, thanks for joining us, and we'll turn it over to you.
Thank you so much, Wendy. And thank you, United We, for continuing to bring attention to this really critical topic. And thank you for inviting us to join you today. You know, childcare operates within a really fragile business model that is currently in market failure across our state. We know that it's an essential business that's critical to our economy, yet it's underfunded and misunderstood. And as you were saying, Wendy, while there's certainly not a silver bullet to solve this complex childcare issues that we face, focusing on the barriers for these business owners themselves is such a great place to start. We know that rules and regulations are critical to ensuring the health and safety of children, and high quality care is the biggest indicator of kindergarten readiness. So we should never lose sight of safety and quality measures. But our early education workforce is struggling. As evidenced in this research, there are barriers to even accessing the tools they need to get licensed, and some of the requirements are simply overburdensome and hard to implement. But I want to kind of return to that flawed business model for a moment. We need to keep in mind that these are small businesses that have to keep their costs low to remain affordable for the families that they serve. This often means they can't offer competitive wages or benefits to their teachers. The trend of teachers who've had to leave the field for better paying jobs with benefit continues to increase as costs continue to rise. Efforts to open new childcare centers to serve more children are essential. Yet many existing providers are forced to close classrooms because they can't find and retain qualified teachers. This leads to lower revenue and a shrinking supply of available childcare. Currently, many providers are operating in our community at 75 to 85% of capacity. Meanwhile, costs are rising for both families and providers, really widening that gap to access to quality care. Without action, this rift is only going to grow. Our hope is that this research will inform and educate others really to drive solutions to address the systemic issues and support the sector's sustainability. I was thrilled to see the case studies featured in this report, as we believe strongly in supporting the childcare workforce. This research really resonates what we hear from providers regularly, and we've witnessed firsthand how powerful mentorship, coaching, and peer learning networks can be to guiding individuals through the licensing process. For instance, our Family Childcare Network offers startup guidance, business training, and a strong community of practice for peer learning. And we've heard over and over again from providers who would have left the field or really abandoned the process altogether due to the barriers if it wasn't for this network and support. And as we examine the policy considerations that were outlined in this report, let's remember that investing in early care and education offers the highest return on investment that Missouri can make. We know that it leads to better high school graduation rates, increases the likelihood of children attending college, and boosts their chances of entering the workforce with higher earnings. We know that high quality early care and education are essential to safeguarding the health and well-being of children who will shape our next generation of workers. When workers and families have access to reliable, affordable, high quality childcare, everybody benefits. Employers, parents, and most importantly, our future workforce. It's a win for all. So thank you, Wendy.
Thank you, Paula. We have just a couple of minutes for questions. If anyone has a question, feel comfortable dropping it in the chat. But I have a question that's come through that I just would like to ask each of the panelists very quickly was there anything that surprised you in the research? And let's start with Jamie. Did anything jump out at you, from the research piece?
Yeah, I'd say the fact that the local challenges are negligible was very interesting to me. I was not expecting that. And then also how actionable the state level recommendations could be in terms of especially addressing the licensing complexity, readability, offering support, better resources. So that was very helpful.
Great, thank you. And Emily?
Rachel will answer this one for us.
Okay, Rachel.
I would say nothing was particularly surprising given the long-standing nature of most of the childcare, both in the state and around beyond it. But one thing I would like to highlight again is the workforce issue. Respondents near uniformly mentioned that it was hard to find and keep staff. And this does impact access because even if these programs have open slots, they aren't able to fill them. So this can impact parents as well.
Great. And Paula?
I don't think anything was really surprising. I think that it did bring home for us just how we've forgotten about the complexity of having to manage both at the state, county, and municipality level, and how complex that can be. So for us, it was just more of a reminder that we have to think of this at all the different levels of support.
And we have a question in the chat. This will be the final question as we're right at time, but Jamie, I'm going to ask you to jump in here. And this is from Jean, is there any thought behind giving a tax credit to parents to offset their childcare expenses? And I know that we've been working on a childcare tax credit for Missouri for a bit. So any highlights you would like to provide there?
Yeah, I appreciate the question. There is a federal tax credit. So we had been focusing more on offering tax credits under the prior administration, Governor Parsons' administration, for employers to help bring them to the table to help offset the cost on families. That has not been successful in the last couple of sessions. So I think this probably will be something that we'll be reassessing to see if it's a viable option.
Thank you, Jamie. We are right at time and we want to be respectful. I want to give a special thank you to Jamie, Emily, Rachel, and Paula for joining us today. A special thank you to University of Missouri's Institute of Public Policy for their great research that you've done. Again, you can access this report on our website at united-we.org. We're going to roll up our sleeves, come up with some innovative solutions, and get to work. So please join us in this effort. And again, thank you, and we hope you have a great day.